எல்லாருக்கும் வணக்கம். நான் டாக்டர் தீபக் குமாரன் பேசுறேன். ஸோ எவ்ரி வீக் சண்டே வந்து ஒரு டாக்டர் வந்து ஒரு டாபிக் பத்தி டிஸ்கஸ் பண்ணுவாங்க. அந்த வரிசையில வந்து இன்னைக்கு நம்ம கூட டாக்டர் தஸ்னீம் சையத் இருக்காங்க. ஷீ இஸ் எ இஎன்டி ஸ்பெஷலிஸ்ட் அண்ட் இவங்க வந்து இன்னைக்கு வந்து இயர் கேர் டிப்ஸ் அண்ட் இயர் ஹைஜீன் அதை பத்தி பேச போறாங்க. ஸோ இந்த டாபிக் பேச போட்டோடனே வந்து லைக் வி காட் நியர்லி 20-25 கொஸ்டின்ஸ் வந்துச்சு. அதில் வில் பி டாக்கிங் அபவுட் த மோஸ்ட் காமன் அண்ட் மோஸ்ட் இம்பார்ட்டன்ட் கொஸ்டின்ஸ். லைக் வந்து ஹெட்ஃபோன்ஸ் யூஸ் பண்றதுனால என்னென்ன ஹியர் டேமேஜ், அப்புறம் வந்து இந்த இயர் பட்ஸ் யூஸ் பண்ணலாமா, வேக்ஸ் இருந்தால் என்ன பண்ணலாம், காது நிஜமாவே கரெக்டாக வந்து குழந்தைங்களுக்குலாம் கரெக்டாக வந்து காது கேட்குதா, இல்லை வந்து அது காது கேட்கலன்னு எப்படி கண்டுபிடிக்கிறது, சம் இஎன்டி டிசீஸ் பற்றியும், நாய்ஸ் பொல்யூஷன் இதெல்லாம் எப்படி நம்ம வந்து இயர் சேஃப் பண்ணிக்கலாம். ஸோ இந்த மாதிரி திங்ஸ் எல்லாம் நம்ம இன்னைக்கு டிஸ்கஸ் பண்ண போகிறோம். ஸோ ஐ திங்க் திஸ் வில் பி a very wonderful செஷன். ஸோ இந்த செஷன் வந்து யூடியூப்லயும் லைவ் ஸ்ட்ரீம் ஆயிட்டு இருக்கு, ஃபேஸ்புக்லயும் லைவ் ஸ்ட்ரீம் ஆயிட்டு இருக்கு. ஸோ இன்கேஸ் உங்களுக்கு பிடிச்சிருந்தா நீங்க யூ கேன் ரெஃபர் டு ஃப்ரெண்ட்ஸ் ஆல்சோ. லாஸ்ட் வீக் we also discussed about diabetes and how to manage diabetes, like சுகர்ஸ் எல்லாம் கண்ட்ரோல்டா அன்கண்ட்ரோலா இருந்தா கூட how கண்ட்ரோலா எப்படி கொண்டு வரது பத்தி எல்லாம் டிஸ்கஸ் பண்ணோம். ஸோ யூ கேன் செக் தட் லைவ் வீடியோஸ் இன் யூடியூப். Okay, over to Dr. Tasneem Syed. You can start.
Hello everyone. எல்லாருக்கும் வணக்கம். I am Dr. Tasneem, ENT consultant from askyourdoctor.com. இன்னைக்கு நான் ரொம்ப முக்கியமான டாபிக் பத்தி பேசுறேன். Because our ears are such wonderful organs. They perform two important functions: hearing and balance. So in the hearing balance, ரெண்டுத்துல எது அஃபெக்ட் ஆனா கூட நம்ம டெய்லி ஆக்டிவிட்டிஸ், நம்ம டெய்லி routine அஃபெக்ட் ஆகும். So it's very important that we take very good care of this precious organ. இப்போ நான் ரொம்ப காமனான இஎன்டி ப்ராப்ளம்ஸ் பத்தி பேச போறேன். So இது வந்து I'm sure all of us would have experienced this. எல்லாருக்கும் இந்த ப்ராப்ளம் வந்திருக்கும். தலை குளிச்சோடனே காதுக்குள்ள தண்ணி போயிடுறது, காதுக்குள்ள தண்ணி தேங்கிடுச்சு, நான் ஸ்விம்மிங் பண்ண காதுக்குள்ள தண்ணி மாட்டிடுச்சு. நிறைய பேர் டாக்டர் இது என்ன பண்றது, காது வலிக்குது. ஸோ இது ஒரு ரொம்ப காமனான ப்ராப்ளம், எல்லாருக்கும் நம்ம எல்லாரும் எக்ஸ்பீரியன்ஸ் பண்ணிருக்கக்கூடிய ப்ராப்ளம் தான். ஸோ நம்ம என்ன பண்ணுவோம், உடனே ஒரு பட்ஜை எடுத்து காதுக்குள்ள போடுவோம். பண்ணிருக்கோமா இல்லையா? ஐம் ஷூர் 99% ஆஃப் த பாப்புலேஷன் would have at least probed the ear with earbuds. Yes or no? But this is a very wrong practice. காதுக்குள்ள பட்ஸ் போடவே கூடாது. Why? Let me tell you that. பிகாஸ் இப்ப காதுக்குள்ள நீங்க பட்ஸ் போடுறீங்கன்னா பட்ஸ் காதுக்குள்ள எவ்வளவு தூரம் போகுதுங்கிறது உங்களுக்கு தெரியாது. இப்ப நீங்க இந்த பிக்சரே பாத்தீங்கன்னா பட்ஸ் எவ்வளவு தூரம் இருக்குங்கிறது உங்களுக்கு தெரியாம இந்த பிக்சர்ல நீங்க பாத்தீங்கன்னா இதுதான் உங்களோட காது ஜவ்வு. இந்த ஜவ்வுல பட்ஸ் உள்ள போட்டதுனால ஜவ்வுல ஓட்டையே ஆயிருக்கு. ஸோ ஓட்டை ஆகலாம், அதனால உங்களுக்கு காது கேட்கிற தன்மையும் குறைஞ்சிடும். இன்னொரு விஷயம் என்னன்னா, நம்ம கை கால்ல இருக்க தோலை விட நம்ம காதுக்குள்ள இருக்க ஸ்கின் வந்து ரொம்ப டெலிகேட் ஆனது. இட் இஸ் 10 times much delicate than the skin in the palms and soles. ஸோ இவ்வளவு டெலிகேட் ஆன ஸ்கின்னை வந்து நம்ம பாதுகாப்பா வச்சிருக்கோம். கை காலை நம்ம சொரிஞ்சாலே அந்த இடமே ரெட் ஆயிடும். ஸோ உள்ள நீங்க வந்து பட்ஸ் போட்டு நோண்டிங்கன்னா என்ன ஆகும்னா அந்த ஏரியாவை இன்ஜூர் பண்ணிடுவீங்க. அதனால உங்க வெளிக்காதே புண்ணாயிடும், வீக்கம் ஆயிடும். அண்ட் சம்டைம்ஸ் இன்னொரு ப்ராப்ளம் என்ன நடக்கும், பட்ஸ்க்கும் அந்த ஸ்டிக் மட்டும் தான் வெளியில வரும். ஸோ காட்டன் பட் உள்ள இருக்கிறது வந்து ஒரு ஃபாரின் பாடி, அது உங்களால கண்டிப்பா எடுக்க முடியாது. ஸோ நீங்க இதுக்காக ஒரு டாக்டர் கிட்ட தான் போயே ஆகணும். ஸோ ஒரு சின்ன விஷயத்துல இவ்வளவு பெரிய பிரச்சனைகள் இருக்கு பட்ஸ் போடுறது. பட் இதே வந்து டாக்டர் வந்து நாங்க இப்போ கிளீன் பண்றதுன்னா எவ்ரிதிங் வி டூ அண்டர் விஷன். ஒரு டாக்டர் எல்லாமே லைட் போட்டுட்டு உங்க வியர் கேனால பார்த்துட்டு தான் எந்த ஒரு இஎன்டி டாக்டரும் கிளீன் பண்ணுவோம். ஸோ அதே நீங்க அட்டெம்ட் பண்ணீங்கன்னா உங்களுக்கே தெரியாது எவ்வளவு டிஸ்டன்ஸ்ல இருக்கும், என்ன தூரத்துல இருக்கும், எப்படி நீங்க உள்ள போடுவீங்க. அண்ட் இயர் கேனால் நீங்க பாக்குற மாதிரி ஸ்ட்ரெயிட் எல்லாம் இருக்காது, இட் இஸ் பெண்ட். ஸோ நீங்க உங்க ஸ்கின்னை கண்டிப்பா இன்ஜூர் பண்ணிடுவீங்க. ஸோ இது நீங்க கண்டிப்பா பட்ஸ் போடவே கூடாது. ஸோ நம்ம என்னதான் பண்ணணும் அப்போ பட்ஸ் போடக்கூடாதுன்னா, இப்ப தண்ணி உள்ளே இருந்து காதுல இருந்து வெளியில எடுக்கணும்னா இட்ஸ் வெரி சிம்பிள், ஜஸ்ட் 3 steps. எந்த காதுல தண்ணி தேங்கி இருக்கோ அந்த காதை கீழே வச்ச மாதிரி படுத்துக்கோங்க. லை ஆன் த சைட் அஃபெக்டட் இயர் வித் ஃபார் ஃபியூ மினிட்ஸ். அதுக்கப்புறம் ஒரு கிளீன் டவலை வச்சு ஃபிங்கரை வச்சு வெளி காதை மட்டும் கிளீன் பண்ணுங்க. அந்த ஃபிங்கரும் டவலையும் காதுக்குள்ள போகவே கூடாது, வெளியில எது தெரியுதோ அதை மட்டும் கிளீன் பண்ணுங்க. இப்போ இப்போ சில குழந்தைங்க இதுக்கெல்லாம் கோஆப்ரேட் பண்ண மாட்டாங்க. இல்ல உங்களுக்கு டவுட் இருக்கு, நான் கிளீன் பண்ணிட்டேன் டாக்டர், ஆனா எனக்கு உள்ள தண்ணி இருக்கா இல்லையான்னு டவுட்டா இருக்கு. அப்போ நான் என்ன பண்ணுவேன்னா, யூ கேன் யூஸ் அ ஹேர் ட்ரையர், ப்ளோ ட்ரையர். ஸோ அது யூஸ் பண்ணீங்கனாலே அந்த ஒரு 2 மினிட்ஸ் நீங்க ஏர் வச்சாலே உங்களுக்கு அந்த ஏர் வாட்டர் எல்லாமே ட்ரை ஆயிடும். ஸோ அதனாலே உங்களுக்கு அந்த வாட்டர் இருக்கிற ப்ராப்ளம் குறைஞ்சிடும். ஸோ நெக்ஸ்ட் நான் இன்னொரு இம்பார்ட்டன்டான டாபிக் பத்தி பேச போறேன். தட் இஸ் த இயர் வேக்ஸ். ஸோ 10ல 3 பேருக்காவது இந்த இயர் வேக்ஸ் ப்ராப்ளம் கண்டிப்பா இருக்கும். ஸோ இதுல நீங்க என்ன தெரிஞ்சுக்கணும் மெயினானா, இயர் வேக்ஸ் இஸ் அப்சல்யூட்லி நார்மல். இட் இஸ் நாட் அ டிசீஸ். இட் இஸ் அ நார்மல் கிளியரிங் மெக்கானிசம் ஆஃப் அ இயர். ஸோ நார்மலா காதுல இருக்கிற தோல் வந்து கிளீன் ஆகிறது வேக்ஸ் ஃபார்ம் பண்ணி தான் அது வெளியில வரும். ஸோ நார்மலா என்ன ஆகும்னா, ரப் பண்ணும்போது தானா இட் வில் கெட் வாஷ்ட் அப். பட் சில பேர்ல என்ன ஆகும்னா, they will have too much of ear wax and this excessive wax will cause ear problem. The excessive wax தான் ப்ராப்ளம். தவிர wax is nothing harmful thing. It is just a normal cleaning mechanism. அது முதல்ல எல்லாரும் புரிஞ்சுக்கணும். ஸோ இப்போ இந்த எக்ஸசிவ் வேக்ஸ் இருந்துச்சுன்னா என்ன ஆகும்னா, ரொம்ப ட்ரை ஆகிடுச்சுன்னா பெயின் வரலாம். அது போய் இம்பாக்ட் ஆயிடும். அது போய் உங்க காது ஜவ்வ அமுத்தும். ஸோ அப்போ உங்களுக்கு இயர் பெயின் வரலாம். இதனாலே உங்களுக்கு காது கேட்கிற தன்மை கொஞ்சம் குறைஞ்சிரும். ஏன்னா இதனால சவுண்டு காதுக்குள்ள சரியா போகாது. ஸோ அதனால உங்களுக்கு காது கேட்கிற தன்மை குறையும். சம்டைம்ஸ் காதுக்குள்ள போயின்னு ஏதாவது சவுண்டு கூட கேட்கலாம். இதனால பிகாஸ் இந்த காது போகும்போது சவுண்ட வந்து இந்த வேக்ஸ் பார்ஷலி போக விடாது. அப்போ இந்த காத்துனால உங்களுக்கு கோயின்னு சவுண்ட் ஏதாவது கேட்கலாம். பட் இதுக்கு நீங்க பேனிக் ஆக தேவையில்லை. இதுக்கு என்ன பண்ணக்கூடாதுன்னு நீங்க தெரிஞ்சுக்க வேண்டிய விஷயம் என்னன்னா, பட்ஸ் போட்டு நோண்டக்கூடாது. நான் முன்னாடியே சொன்ன மாதிரி பட்ஸ் போடாதீங்க. ஸோ நீங்க பட்ஸ் போட்டீங்கன்னா என்ன ஆகும்னா, உள்ள ஆல்ரெடி சொன்ன மாதிரி பட்ஸ் காதுக்குள்ள போடாதீங்க. இப்ப நீங்க இந்த பிக்சரை பாத்தீங்கன்னா வேக்ஸ் இருக்கு உள்ள. நீங்க உங்களே அறியாம பட்ஸ் உள்ள போடுவீங்க. உள்ள போட்டீங்கன்னா என்ன ஆகும், இந்த பட்ஸ் வேக்ஸை நீங்க இன்னும் உள்ள தள்ளிடுவீங்க. ஸோ உள்ள தள்ளிட்டீங்கன்னா அந்த வேக்ஸ் போய் ஜவு கிட்ட போய் ஒட்டிக்கும். ஜவு கிட்ட ஒட்டிக்குச்சுன்னா அதை எடுக்கிறது ரொம்ப கஷ்டம். ஸோ ரொம்ப நாள் ஆகும் நீங்க அதை திருப்பி எடுக்கிறதுக்கு. டாக்டர் கிட்ட போனா கூட அவங்க வேக்ஸ் பார்த்துட்டு உங்களுக்கு டிராப்ஸ் கொடுப்பாங்க. ஸோ அதை எடுக்கிறதும் சிரமம் ஆயிடும். ஒரு சின்ன பிரச்சனைய நீங்களே கொஞ்சம் பெருசு பண்ண மாதிரி ஆகும். So I was talking about ear wax. So ear wax is nothing but it's a normal cleaning mechanism of ear. It is just produced, it will get washed out away normally. From it, the wax will move out from your ear canal and it will get washed out to the outside. But in some people, this excessive wax will get formed. If this excessive wax will only cause problem, normal wax is not a problem. So in excessive wax, what problems you will have is, you can have hearing loss because this wax will get impacted and it will cause hearing damage. Then other problem is, because of this impaction, you can have ear pain also. Because of this ear wax impinging on the eardrum, it will cause pain. And sometimes you can have some ringing noise in the ear, which is also because of this wax impaction. So what you should do when you have wax is, you should never try to dig it out. Never attempt for immediate removal using your buds. Because as you see in this picture, you're seeing that you're using the buds, and this buds will push the wax more deeper inside into the canal. And if you push it more into the canal, to remove it becomes very difficult. It will get impacted. So never try to probe it out. So if you ask, what should I do, doctor? If you think you have a wax, you should go to the doctor and check. And the doctor will tell you whether it is soft or dry. If it is soft, doctor will remove it under vision. But if it is dry and hard, he will prescribe you ear drops, that is wax softeners. They will soften the wax, and after it gets softened, doctor will be able to remove it easily. You should never try to probe using earbuds. So next I'm going to talk about another very important topic, that is ear discharge. So this ear discharge is a very common problem usually seen in kids and adults after an episode of upper respiratory tract infection. So usually you will have the children will get cough and cold. After, if you find any ear discharge, it is important that you go and consult a doctor immediately, because ear discharge should not be neglected. But when you go and talk to your doctor about ear discharge, you should know these important things. First, you should know the duration of ear discharge. You should find out, you should think whether it's coming continuously or it is intermittently. Because some patients might feel that if they take a head bath, the ear discharge becomes more. Or if they had any cold items, if they took an ice cream, they went for a party, they had an ice cream, and following that they had a episode of ear discharge. So these kind of things which makes the ear discharge more, you should note it as a patient and inform your doctor. And next important thing which you should know is the quantity of the ear discharge. How much the ear discharge is, whether it's more or less. Like how you will know whether it's more or less is like many patients will come to me and saying, Madam, I slept yesterday and my entire pillow was soaked with the wet and it was fully foul smelling. This says that if the ear discharge was more because overnight the discharge has come out from the ears and it has soaked the pillow cover. So this is one indication that there's more ear discharge. And for scanty, some people will have a feeling. I have some feeling of only wetness in the ear, but nothing is coming out. There is some feeling of water or something staying inside my ear. So that is an indication for scanty ear discharge. Then another important thing which you should know is the color of the ear discharge. Color is very important because it can give hint to your doctor about what kind of infection or organism is there to know for causing this ear discharge. Certain colors like yellow, green, brown, you should note and inform your doctor. And another important thing which you should know is whether your ear discharge smells or not, foul smell, or whether it is blood, whether there is ear pain associated. So these are the important things in ear discharge which we should know as a patient and inform the doctor for further management. Never take ear discharge as a light problem. Consult your doctor immediately. And another important thing which I would like to highlight in my talk is about how to use ear drops. I'm sure all of us would have had some ear problem and used ear drops for it. But how many of us know what is the correct procedure to use ear drops? So today I would like to guide you all on how to use the ear drops properly. So first, as you see in this picture, it's better to lie down with the ear facing up. For example, if you want to put drops in your right ear should be facing up. It's preferable to keep a towel underneath also. So pull your ear. Next picture, you can see he's pulling his earlobe. And you just pull it, retract it little so that it will widen the ear canal. So if you widen the ear canal, administering ear drops will be much easier. And as you can see in the next picture, you will administer only the required number of ear drops. If doctor has told you 2 drops or 3 drops, administer only those required number of ear drops. Then after you put the ear drops, gently push your ear flap. That is, and open your mouth. You press against your ear and you open your mouth. So this movement of opening mouth and pressing your ear will make the ear drops enter deep into the ears. And it will stay in there for a long time. And after you press this, stay in this position for another 2 to 5 minutes so that the drops has its action inside. So because many people are not aware how to use this ear drops, they come back frequently to us saying that the infection has not been resolved because the drops which they using doesn't even enter that we all should know how to use the ear drops properly. So next, I would like to talk about this interesting thing, foreign bodies in the ear. So now we are seeing a set of pictures. These are the pictures of foreign bodies which I removed from the patient's ears when they had come to me in the OPD. So this first picture, what you see is a pencil tip. This is a pencil tip. Usually these foreign bodies are seen in children aged 2 to 5 years. And also we can expect foreign bodies in children less than that. Maybe the children of 6 months, 7 months also have seen a foreign body. In such case, the foreign body is not inserted by the child. It is inserted by the elder sibling, brother or sister, whoever was playing with them. So it's very important that parents should have an eye on what are the toys that the children are playing and what are the remaining things. So this first picture, as you all can see here, this is a pencil tip, which I removed from a 4-year-old child who was playing with the pencil and while doing his homework. His mother came and told me that the pencil tip was missing and the child did not give a history that he put it inside his ear. So the frightened mother, anxious mother, took him to me to find out if there is any foreign body. And luckily the foreign body was in his ear, which we removed. So parents also have to be very anxious and alert to know if the child playing with the toys is safe or not. So the next picture, this is a small insect which has gone inside an adult. He came to me complaining that the insect went inside and I removed it easily. So this is a neglected foreign body. Actually, this is a peanut. This peanut, the child had put, 2-year-old child had put inside the ear and nose. So both places there were foreign bodies. So the child was not aware, the parents were also not aware, but they came to me saying that the child had nasal discharge from the nose. But they did not give me ear complaint at all. So when I accidentally removed the foreign body from the nose, I checked up the picture. It's a very interesting one. This is a leech which was found inside the patient's ear. This patient gave me a history of blood coming from the ear. He did not give me a history of any foreign body or any insect going inside the ear. He told me his bleeding comes from the ear occasionally for 2 weeks, on and off, it subsides on its own. But on examination, I found this leech and removed it. And this is just a bead from the earring which slipped into the ear. So these foreign bodies is very important. These foreign bodies can also become an ENT emergency. So it's very important that we are aware of this and take good care of our children. So what you should not be doing is you should not panic and never try to probe. One common thing in our community is they put this heated oil, heated coconut oil or heated gingerly oil into the ears, thinking that it will kill the insect and it will come out. But that is not the right practice. Putting oil deep inside the ear will push the insect more into it. And if the insect goes and attaches to the eardrum, removing the insect will become very difficult. So if you feel any foreign body sensation, please consult your doctor immediately. Never try to do anything. Another important issue which I would like to speak is rising nowadays is hearing loss. In this online world, we all are prone for loud noises through either headphones or headsets. So what is the problem with these headphones and headsets? The problem is the sound directly goes to the inner ear. So when you're using headphones, as you can see in this picture, the sound directly goes, this is your eardrum. So this is your middle ear and this is your inner ear and this is the nerve which goes to the brain. So when you're using headphones and high volume sound damage, you can definitely develop hearing loss. And this noise induced hearing loss is very common in these kind of professionals, like those of traffic police, industrial workers, those who attend rock concerts frequently. So these professionals should be very careful and should be very alert in checking their hearing levels frequently. And also very common thing is most patients come to me saying, if I ask them a question, do you have any hearing difficulty? They say no. But the ones who come with them, either the wife or the children, they say, yes, doctor, they have hearing difficulty. But when being questioned, they don't tell me. So what is the reason for this? It's because they are not even aware that they have a hearing loss. How can this hearing loss be detected? It is when you have a difficulty in conversation in case of background noise, such as in crowded places, in markets, in malls. You can't hear your partner speaking to you. So this is an indication that you have a hearing loss and it needs to be consulted. Next is difficulty over phone. Many people prefer using over one ear than the other or using cell phones. They'll always use the right ear for talking over phone. They don't use the left ear. Unknowingly or knowingly, they won't even realize that their left ear is having a problem. So that has to be addressed too. So if you preferentially using only one ear for a phone, you have to get your ears checked. Then also another factor is whether you're using your TV or radio volume louder than others. If someone feels volume 20 comfortable and you need 25, that means there is an indication that your ears are at risk. So please go and check it up immediately. And you frequently ask them to repeat the questions or repeat the sayings. And another important thing is hard time hearing environmental sounds like birds chirping. Birds chirping sounds or any minute animal cooing sounds are all minute sounds which will be heard only in the normal ear. If you ask, please think on this loud noise. So what you should do is reduce the TV volume to 60%. Never make your TV volume more than 60% and never use your headphones continuously for more than 1 hour. And when you're exposed to loud noise, you should use your earplugs. And in traffic, avoid unnecessary honks. And wherever you're working, use hearing protection at your workplace. So another common question which I often get is how to clean my baby's ears and when to clean my baby's ears. So this is the same principles which I said in the beginning of my talk. Like how you have to clean your ears, same thing applies for even for cleaning the baby's ears. So you use a warm wet cloth, don't have so much of excess water, rinse the excess amount of water and wipe off the outside of the baby's ears. Don't probe your finger into the baby's ears and never put buds into the baby's ears. And another thing which they ask me is how often should I clean my baby's ears? There's nothing as stiff and fast rule for cleaning baby's ears. You can clean your baby's ears daily during bath, like how I just mentioned now. So to sum it up, so ear care tips, these are the important ones. Never use earbuds. I already told you what are the problems you will face of using earbuds. Next, use earplugs for loud music. Hearing is a very precious thing. Don't damage it. So keep the sound as low as possible on TV and radio. Keep your ears dry. As I told, the native practices being practiced, putting oil into the ear or putting water into the ear should be avoided. You should use only the prescribed drops into the ears. Then have a regular exercise. Walking and cycling or doing any form of gym exercises is also very good because exercises increase the blood supply to the ear and which makes your ears more healthy. Just like it's good for everything, all parts medicines can have side effect on ears. So use only those medications as prescribed by your doctor for a long duration. Never take self medications. So lastly, avoid stress and have a regular health checkup because with early diagnosis, we can solve the problem at earlier stage itself. So as we all better know, prevention is better than cure. So take utmost care of this wonderful organ and thank you for your patient listening.
Very nice presentation. Thank you, Dr. TASNEEM SYED. And before going to the questions, we have some questions in the chat box also. Let's discuss that first thing. First question is, someone has mentioned that there is some hereditary ear disease. He wants to know whether it will be whether it will be affect other members also, but he has not mentioned what kind of disease, what kind of ear disease. So
Okay.
you talk on hereditary ear disease.
Okay. So hereditary ear disease, meaning he'll be mentioning only about hearing loss. Hereditary hearing loss is where is there. There is genetic reasons for hearing loss and there are chances for it running into families. So it is better you get a genetic counseling before you're planning for a pregnancy or to know if this disease will run in the families. So if by genetic counseling, we will come to know what kind of gene is affected, whether it is a dominant gene or a recessive gene. So dominant gene has more chances of being running into families and recessive gene has less chance. So based on what your problem is, your genetist will be helping you to know whether this disease will run in families or not. But there is a chance for hereditary hearing disorder to run in the families. I hope this answered the question. Any other questions, Deepak?
Hello. Yeah, I have a question. There is a
Yes.
question in the chat box. I am
Yes.
having impacted earwax and she's taking ear drops. She wants to know for how long she can wait to whether how long she can use that ear drops to make the wax soft.
Okay, this is a very interesting question. So you have to know that minimum you have to use ear wax or softeners, that is ear wax solvents or softeners for at least 1 week to 10 days. And you have to apply it in the way which I already told in my talk. Only then the drops will penetrate inside the ear canal and soften the wax which is deep inside also. Otherwise, what will happen is the drops which you use will only will soften the area of the wax which is close to the ear canal. The ones which are very deep inside near the eardrum won't be softened. So removing that will be a problem. So you have to use it for a minimum of 1 week and you have to use it in the way which I already mentioned.
Should we use cotton buds daily?
No, definitely no. That is what I was trying to highlight in my talk. Do not probe anything into your ears, especially the cotton buds, which is a very common practice followed here. You should never probe anything, as I already said, because the ear canal skin is very delicate. It is very soft and it is 10 times softer than the skin of your palms and soles. So you try to probe, you will injure it and you will damage it more. You can even cause inflammation and it will result in infection of your external ear also. So don't try to probe anything. The wax which has to be cleaned will automatically come out that you can use your finger and towel and wipe the side of your ear.
Okay, someone wants to know whether how to test if hearing is normal or not.
So as I already told, how you can test here, how you will know whether your hearing is normal or not. You can see you will have difficulty in hearing conversations in crowded places like markets and malls. They will hear very quiet. They'll be able to hear very without difficulty in quiet room surroundings. But in crowded places, you might have a difficulty. You might have a difficulty in hearing phone conversations. Whereas you won't have difficulty in talking face to face. Then you can also know that you can have some ringing sensation in the ear. Occasionally you might feel something is buzzing around or something is hearing within my ear. So all these indicate that you are having some hearing loss. So it's better if you have these symptoms, you can go and consult an ENT doctor and they'll help you to know if there is hearing loss or not.
Do you suggest any specific type of headphones to avoid noise-induced hearing loss?
Headphones as such, they cause damage to the ears. But there are 2-3 different types of headphones available in the market. One is the over-the-ears headphone, which there is a cup and you place it over your ears. And the other is the insert type of headphones, which you insert it directly into the ears. So since both headphones, whatever be the headphone type you are using, if you are using a loud noise, which we say as more than 80 decibels, decibel is the measure which is used for measuring the sound. So if you use any loud sound, any headphone you use is harmful only. But when comparing, if you ask me which is a better headphone, I would suggest supraoral, that is over the ear headphones, is a safer type than the insert headphones. Because insert headphones itself will cause around 9 decibel extra hearing loss.
Thank you for the information, doctor. What are some of the ways to combat higher noise pollution in dense urban areas? This is a very common problem in those who live in the cities. So a few words on that.
If you are going to loud places where there is loud exposure of noise, it's better to use earplugs. Nowadays in markets, we get different types of soft reusable earplugs also. You can just buy, wash it and use it again and again. So you can use earplugs. And the question was very specifically about urban cities, how to control noise. So in urban, the most common cause of noise is traffic. So we being responsible citizens and taking good care of others also, we should avoid this unnecessary horn. And also we should regularly give servicing of our vehicles to know that they are in good condition and they don't produce the noise as prescribed by the government norms. Government has given a notification also what should be the noise levels from each vehicle. So I'm sure if we send our vehicles for servicing regularly, this noise induced hearing loss will definitely come to a reduce.
Okay, and should we worry about ear disease? Like if I have some ear problem or ear discharge, something ear block, should I worry or is it not so very alarming?
So as I already said in my talk, ear discharge, whenever you see a ear discharge coming, it's better that you consult your doctor immediately because ear discharge is not a normal thing. As I said, wax is just a cleaning mechanism. It is a normal thing. Excessive wax only causes problem. But ear discharge signifies there is some underlying disease beneath. So if you have ear discharge, whether it is intermittent or persistent, based on, as I already highlighted the points, you should know the duration, you should know the color, what color is it, whether it's foul smelling, whether it's blood stained, or when does it get aggravated. All these important things you should note and definitely inform your doctor. It is nothing like you can sit back and relax. It's better you go and consult and find out what is the reason for that ear discharge.
Okay, doctor. Can you say how stress is linked with ear disease? Stress and exercise.
How?
Stress. You mentioned that avoid stress.
Yes.
So how is it linked with ear disease?
Yes, stress doesn't affect only ears, it affects your entire body. As I said, exercise helps increasing the blood supply to your ears, making it work healthy. So stress decreases everything. So you get a hypertension, you get a diabetes because of your stress. And this will indirectly have effect on your ears. So stress can also cause hearing loss. Stress-induced hearing loss is a very common entity which is being arising nowadays. So even young children, college students, there are 2 or 3 of patients who got hearing loss just because before the exams because of the excessive stress which they took during their exams. So this has some problems in the microcirculation which can cause decreased blood supply to your ears, and because of hypertension you can have some blood clotting things in your ears which will cause hearing loss. So definitely stress has an important role.
Okay, I hope you answered all the questions very nicely. If there is any doubts, you can ask, unmute and ask. Viewers, if you have any doubt, you can unmute and ask.
I would be happy to take any question.
Good evening, doctor.
Can you hear me?
Yes,
I would like
yes, sir, continue.
No, you are talking to Said Musta.
Yes, sir.
Can you hear me?
Yes, I can hear you, sir.
Okay, Dr. Tasneem, I just wanted to know. See, when I go to the bed, my ears are okay, my sound is okay. But when I get up in the morning, I
Yes,
feel
sir.
as if my ears are blocked. I'm getting less
Okay.
voice. Less voice, less noise. Then
Okay.
after some time, it is getting okay. So, what is the reason when I'm getting up, it is blocked? What is the reason? What
Because
could
of another condition known as eustachian tube dysfunction, sir. We all should know there is a connection between nose and the ear through a tube. So when you're lying down and sleeping in the night, the tube becomes slowly closed and gets collapsed. So that is why when you get up, you're having this problem, your ears get blocked. But as you get up and you do your daily activities, you swallow, you eat, the tube slowly eventually opens and it becomes normal. So what you have to do is there's a simple exercises which you can follow and uh, make this issue no issue.
Uh-huh. Okay, and one more thing, and see, I always feel that I have that nose, no. So from
Yes.
one side I'm, breathing, another side is not being used, and sometimes right side, sometimes it is left side. So is this the problem, or it is normal, physical condition?
Unless your nose block causes difficulty, doesn't help you do your daily activities, it is not an issue at all, sir. It is normal.
Normal. Okay.
At one point of time, only one side of your nose will be more wide, another side will be narrow. This is a normal physiology. So unless this nasal block is causing you difficulty, or it is associated with some nasal discharge, or associated with loss of smell, or associated with any difficulty in your daily routine, you need not worry about it.
So, doctor, I just want to know. So, you mean to say that both the that the two holes in the nose. So, we are not using at a time, So, only one side being used.
Yes, one side is being used more. One side will be more wide and patent compared to the opposite side. It is a physiological cycle. The body will automatically regulate it every 2 to 8 hours. This will vary from individual to individual. You might have a cycle of 3 hours. I might have a cycle of 5 hours. Other one might have a cycle of 8 hours. So it will vary from individual to individual. It's a normal thing, nothing to worry about.
Okay, thank you, doctor.
Good evening, doctor. Hello.
Yeah, we can hear you.
Yeah, I just have one doubt, doctor. I would like to know, like the ear pain which we have gets aggravated only in the night. That's a similar case with our toothache also. Is there any specific reason for that?
You mean earache only when lying down or during the period of night?
Period of night, I mean, but when it comes in the evening and the night, when we have the earache, it gets aggravated. Usually the ear pain.
That is most commonly seen in children. Have you encountered it, or are you asking on behalf of someone?
Yes, my son has that issue.
Okay. It's mostly commonly seen in pediatric age group because the ear pain, as I said, already there is a connection between the nose and the ear through a tube. So this tube during the night time, you will all know the environment temperature falls down. So the more common chances, as I already told for the previous question, the tube will tend to collapse and it will narrow down. That is why ear pain gets aggravated during the night times. And it's more common in children because they have the tube at which the angle it is placed is very narrow in children. But as we grow up, it becomes widened and this doesn't cause a problem in adults.
Okay, fine. Thank you, doctor.
Any other questions? Anyone wish to ask a question? Okay, can you? I have a question, doctor.
Sir?
You said that ear is responsible for two things, and one is the balance. So, what will happen if there is some problem in balance?
Yes, this is a very important thing which we all should know. Ear is very much important for balance. If balance lets, you will have this feeling of giddiness. You will have this feeling of unsteadiness. You will feel the world is rotating or you are rotating. The room is rotating. You won't be able to walk. So many connections for giddiness. So here is one of such components. So usually, ear problem causing giddiness is they'll usually have this complaint. They'll get up from the bed in the morning, they'll have a giddiness for 1 or 2 minutes, and then it will become normal. So this is typically because your inner ear, which senses the balance, has some issue which has to be addressed. You have to take a consultation to know if this kind of giddiness is caused by ear or whether it is neurologic. Other causes of giddiness can be neurological causes or central causes, meaning the brain issues. Some problem in the brain can also cause giddiness. Some problem in your spinal cord, some problem in your bones and eyes can also cause giddiness. So ear is also an important cause for giddiness.
Okay. And one final question: is hearing loss reversible?
In initial stages, it is reversible. It is based on the type of hearing loss also. We classify hearing loss as 2 types. One is sensory neural, other is conductive. Conductive meaning only when your outer ear and the middle ear is having a problem, it is conductive hearing. And when your nerve and your inner ear is damaged, it is sensory neural. So when you and this hearing loss can be reversible and it's treatable. You can do a surgery also and you can make it absolutely normal, or you can make it to problem stage in which there is no problem. But if the hearing loss affects the ears, like how I told in my talk, when you're using loud noise, it directly goes and affects the inner ear and the nerves. If it affects the nerves and ears, it is very difficult for us to revert it back to normal. We can just prevent the further worsening of hearing, but we cannot bring it back to normal 100%. So it is based on what type of hearing loss that your doctor will be able to tell you whether it is curable.
Okay. And I'm sure everyone would have benefited with this session, and I'm sure everyone will follow the take-home message also for a healthy ear, especially the ear wax related problems. Any more questions?
Yes, I have one question.
Yeah, please.
It is a general question about knowing about nose and ear.
Okay.
So when we are sleeping, our nose is in action. That means we are breathing, but our ear is not working. That means we are not hearing. What is the main reason?
No, sir, it's a very tricky question which you have asked. So the thing what you said is when we are sleeping, the nose is working and the ear is not working. No, it is not like that. You still hear the noise, the word and the noise and the sound which you hear, which is happening in your surroundings, is carried over by the ears from the nerves to the brain. But only your brain is put to sleep, so your brain ignores the sound. But only in case of loud sound, your brain is being alarmed and you wake up. It's not that you don't hear. Your ears do the hearing continuously. It's just your brain ignores the sound. Your ears are continue working. Like you can see, a mother will be able to recognize and get up for the sound of a child, even though she's sleeping. It's because the brain is awakened by it.
Very good, very good.
Okay. Okay, I think we can end this session.
Thank you, everyone.
Thank you, Dr. TASNEEM, and thank you for your time. It was a very nice session. And viewers, if you like the session, please share it to your friends, and it's also available in YouTube also. You can give the feedback to 9600842698, and we are happy to hear from you. Thank you. Thank you all.
Thank you all once again.
Thank you very much.